Going through nursing school with my best friend has been such a blessing. In the studying aspect, it's beneficial because we always have one or another brain to bounce ideas off of. And when one of us or both of us are stuck on a question about any class, it's always nice that we can ask each other.
Yeah, and it's also been very encouraging to know that you have someone that is going through the same thing and is in the same boat as you. And because of this, we have been able to hold each other accountable and ensure that our deadlines are met.
Ever since I was a child, I knew I wanted to become a nurse. My mom has always worked in the hospital setting, so I grew to learn about what the environment was like, and I absolutely loved it. I love caring for others and helping them be the best versions of themselves. So becoming a nurse, you really get to help them become the best version of themselves and be in good health.
I chose nursing as a career because of my mom. Growing up, I loved the patient stories and scenarios that she came home with because she was a home care nurse and going into people's homes. I really look forward to visiting patients at really vulnerable situations and times in their life, and then just kind of helping them gain a baseline function so they look forward to a future outside of the hospital.
What I find most rewarding about being a nursing student is seeing all of our hard work pay off in the field. What we learn in class is what we get to implement on real patients, which is super exciting. But not only do we get to learn and perform skills, but we also get to create strong patient relationships, which is something I really value.
A typical day as a nursing student for me is getting up and maintaining a routine. I think structure is really important as a nursing student. I like to do my school and studying first in the beginning of the day to ensure that I'm not stressing about it as my day goes on and I can focus on other things if needed. Mondays and Fridays we have lecture all day and are usually pretty tired after this. Tuesdays we have lab where we practice skills on dummies and we can kind of put our skills to the test. Wednesday we have clinical where we are at the bedside working with patients and we are performing those skills for our instructor. Thursday we have a day off where we can kind of get ahead or just work on schoolwork that needs to be done, any assignments that are due.
There have been some challenges that I have endured during my clinical experience at the hospital, and one is becoming more of an independent student nurse. We have our own patient that we get to take care of. We have to administer medications to them, provide daily cares, and educate our patient on their diagnosis and what further actions they can take. So this role has just been implementing what we learn in class into the real life, which has been definitely a transition, but in the end, learning from these challenges will make me a better nurse.
So advice I would give to future nursing students who are considering joining the program at Oshkosh is to allow time for your friends and family, but also focus on your grades and what needs to be done. In the nursing program, it's also really important to not compare yourself to others. Do your own thing, do what's best for you, and be confident in your own abilities and your knowledge.